Governor Charlie Baker is joining us in the studio. Let's go on the record. Shot in the arm, the governor got his first dose of the COVID-19 vaccine. Is his view of post-pandemic life any clearer? The critical steps toward a new normal.
From WCVB Channel 5, the inside word from Washington to Beacon Hill. Today's newsmakers are going on the record.
Welcome everybody to OTR. I'm Ben Simoneau in for Ed Harding this morning, and I'm joined, of course, by News Center 5 political reporter Janet Wu. And we are pleased to welcome Massachusetts Governor Charlie Baker to Studio C. You can see we've got a pretty large space here, and it does give us the room for plenty of proper social distancing. All right, Governor, thank you for taking the spot at the center desk this morning.
Happy to be here.
Let's dive right in. We're hearing about a fourth wave, COVID variants moving too quickly despite the speed up of vaccination distribution here and throughout the country. Are you worried?
Well, first of all, I think it is important for everybody to understand that there continues to be a significant presence of COVID, not just here in the Commonwealth, but around the country. And in the Northeast in particular, we have seen a significant presence of a more contagious variant. And therefore, it's really important for people to continue to be vigilant about this, and especially in informal settings with people who aren't part of your household bubble, to keep your distance, wear a mask, and continue to abide by all the rules and guidance that are in place. We lead the nation in vaccinations among big states. We'll continue to do that. We're one of the few states that's actually vaccinated 40% of all of those over the age of 18. But we have a long way to go here, and it's really important for people to understand that COVID is not gone.
For those of people here that are still struggling to get appointments, and some people do you encourage them to go to New Hampshire? Because New Hampshire has just opened up their vaccinations to anybody. You don't have to be a resident there.
Well, here in Massachusetts, if you live, work, or study here, you're eligible. And as I said before, we have we do have the highest vaccination rate among states that have more than 5 million people in the country, and we plan to continue to overperform on the doses we receive from the federal government. I don't know exactly what the change in the rules in New Hampshire might have been about. It could be about college kids, but here in Massachusetts, as I said, if you live, work, or study here, you're eligible, whether you're from here or not.
Are you hearing that folks are having less trouble getting appointments? Because I do hear stories of folks that are still struggling a bit.
Well, let's face it. Massachusetts has a very enthusiastic population. People want to get vaccinated, and that's why we set up a pre-registration system. And as I said the other day in one of my press briefings, we have over 1 million people who've pre-registered. And while we continue to lead the nation in terms of the percentage of our population that's dosed overall, the percent of our population that's received the first dose, and the percent of our population that's been vaccinated among all states with more than 5 million people, there's about 24 of those. We have a lot of demand here, and if we had more supply, that would make a big difference. I sort of feel like I've been waiting for the big moment at which we have more supply than we have demand for a while now, and I hope and anticipate at some point the production actually catches up with how many people here actually want to get vaccinated. But I can only vaccinate as fast as we get doses from the feds.
Well, we do know that the vaccine distribution rates have gone up pretty dramatically, especially over the last month or so, as more supplies have become available. But the percentages are still lagging in core areas of some of the largest cities where people of color live. So what more are you doing, or can you do, to convince those folks they've got to get those doses?
Well, the first thing we've done is partnered with a lot of trusted voices in many of those communities. Community-based organizations, local leaders, faith-based organizations, community health centers. We have huge relationships with them all over Massachusetts. And we now have folks who are actually door knocking in many of those communities to encourage folks to get vaccinated, and doing so in multiple languages. We've also got a pretty aggressive homebound program to make sure that we get out and touch people in places who can't actually come to a vaccination site, whether it's at a church or a community health center or some other local location. But I think in many ways, one of the things we're going to need to rely on here is word of mouth. Some people get vaccinated who you know, then maybe you decide it's okay. Conversations with your clinician, which clearly make a big difference with respect to people being willing to get vaccinated. But we're spending millions of dollars with our colleagues in many of these communities, the 20 so-called disproportionately affected communities here in Massachusetts, to make sure that we're doing everything we can to reach and touch those folks and hopefully get them to come out and get vaccinated.
There's been a couple of hiccups. I don't want to call them issues with the Johnson & Johnson vaccine because the CDC says they're largely normal side effects, but in a couple of states they had to shut down some distribution centers for a day while they assessed. Are you concerned at all about the Johnson & Johnson vaccine?
Well, I think about 125,000 people in Massachusetts have received so far the one-dose J&J vaccine. We're not aware of any significant problems associated with that. There are some people who will have negative reactions to vaccines, and that's been true since the very beginning of this. But I have to point out that with respect to the vaccines generally, roughly 85% of the population over 75 years old here in Massachusetts has been vaccinated, and it's had a huge positive impact on both the number of cases we see that involve people over the age of 75, the number of people who get hospitalized who are over the age of 75. The vaccines clearly work, and I think it's really important for people to understand that.
Let's talk about schools, Governor. Latest numbers show nearly 1,000 new COVID cases among teachers and students, and this happened, the numbers were from the first week the elementary schools went back full time. Does this worry you at all?
Well, first of all, as I said before, there are variants, right? And we all need to pay attention to that and continue to do the things we need to do in informal settings. But all the data, overwhelmingly, in Massachusetts, across the U.S., and across the world, is that school is a relatively safe place for kids and adults, especially if people take advantage of the mitigation practices that are in place and have been in place literally in hundreds of school settings for thousands of kids and adults since August. I mean, many schools in Massachusetts, public, parochial, and private, at every level have been in class since August with very little issues concerning COVID, and many of these are located in communities where there was very significant spread. The big issue here is people need to continue to do the kinds of things that limit the spread in their informal gatherings and settings. Most important of all, but school is safe.
So you're not going to, the schedule that you laid out for the older students going back to school remains the same, no changes, right?
You talk to anybody in the pediatric community and they'll tell you that the impact developmentally, emotionally, socially, much less educationally on kids from spending a year, over a year in many cases, away from their friends and from in-person learning has been profound. And as I said, there's tons of research at this point that says school is among the safest places kids and adults can be. I think it's terrific that our elementary schools are going back. I'm thrilled our middle school kids are going back, and I really do hope most of our high school kids get back. This is, and we have real world demonstrated evidence, 10 months of it almost now here in Massachusetts, that this not only is a good idea, but it works.
Governor, have you made any mistakes or have any regrets in the pandemic plan? I know you've talked about the phone line and the website issues with the vaccine. What can you point to looking back and say, I wish we had done that differently?
I think there's lots of things we wish we'd done differently. I think one of the things we've tried to do as an administration is to make adjustments. And in many cases, some of the stuff had to do with the quality of the information. And this is no put down on anybody who provides information, because this is a novel coronavirus and people have been learning as we go. Dr. Fauci, for example, at the beginning of all this said that he didn't think there was much asymptomatic spread. That obviously turned out not to be true. And that had huge implications for the way many people here in the Commonwealth and around the country actually dealt with this issue. So I think one of the things we all have to recognize and accept here is that because this was new, because people were learning as they were going, guidance changed, decisions changed based on the guidance changing, and facts in many cases drove decisions that were different than the ones people had, weeks or months before that, or in some cases days before that, because of the changing nature of what we knew about how this worked and what we needed to do to deal with it.
But as far as things that you could control when it came to vaccine distribution, would you have done things differently at all? Things that you could have done differently?
We're the number one state in the country right now in terms of vaccinating our population, if you have more than 5 million people. And we've been number one now for almost a month. And as I said before, we're the only large state that's actually vaccinated with one dose 40% of our eligible population at this point. I said it was going to be lumpy and bumpy before it even began. And I think there's no question that there have been tough days, not just for us, but for everybody else, because this is something new and not something people have done before. But I can tell you right now that if the federal government doubled or tripled the amount of supply they made available to us at this point, we could double or triple how fast we could pursue vaccinating people here in Massachusetts. We have a ton of delivery capacity at this point, and I'd love to put it all to work.